Zones of blood flow in the lung. P with the uppercase letter A means the alveolar pressure. P with the lowercase a means the arterial pressure. And P with the uppercase V means the venous pressure. So the lungs are divided into zones based on the pressure differences caused by gravity. In the first zone, the alveolar pressure exceeds the pulmonary arterial pressure and exceeds the venous capillary pressure. Therefore, the alveoli is greater than the capillary. Because of this, little gas exchange takes place. The blood flow is very limited. Zone 1 conditions are generally said to be absent from normal lung under physiological conditions. In Zone 2, the pulmonary arterial pressure exceeds the alveolar pressure and exceeds the venous pressure. Therefore, the blood flow is dependent on the gradient between the alveolar pressure and the pulmonary arterial pressure. Under systolic conditions, it is greater than the alveoli. Under capillary diastole, it is less than the alveoli. In diastole, in conditions when there is a drop in blood volume, the pulmonary arterial pressure may be lower than the alveolar pressure, which means flow would only occur during the systolic condition. You can see over here that the arterial pressure is greater than the alveolar pressure, which is greater than the venous pressure. This is the place where there is adequate amount of blood flow and airflow. Zone 2 pressure takes over when there's an increase in cardiac output or exercising or if there's pain or stress. In Zone 3 pressure, the capillary pressure is greater than the alveolar pressure. So both the pulmonary arterial and pulmonary venous pressure exceeds that of the alveoli. So the lowercase a is greater than the V, which is greater than the uppercase A. Therefore, the flow is proportional to the gradient between the arterial and the venous pressure. Alveolar pressure does not play much of a role here. The blood flow to this area needs to exceed the blood flow to all the other areas. Therefore, you'll see that it begins to open up the blood vessel and therefore increasing more blood flow from the arterial side to the venal side. For adequate gas exchange, ventilation, which is how much air is presented and airflow to the lungs, needs to match perfusion, Q, which is the blood flow through the blood vessel, also known as VQ matching. In normal conditions, the airflow or the ventilation or V should be similar to Q, so the blood flow from the pulmonary arteries to the pulmonary veins are balanced out. In this condition, there's a normal VQ in the middle of the lungs and the value is 1. When there is an issue with the airflow, let's say there is an impairment to the air sac, there's going to be a change in the VQ. The blood flow may be the same, but because there's impaired ventilation, it results in a low VQ, a value less than 1 at the middle of the lung. In the dead space ventilation, there could be some sort of a blood clot, an embolism, or hypertension changing the blood vessel. Therefore, the blood flow is damaged. The airflow is still normal. As a result, you're going to have a high VQ at the middle of the lung, a value of greater than 1. The volume of air in regions that don't participate in gas exchange is referred to as the alveolar dead space. Ventilation and perfusion have to be matched for gas exchange to occur. Therefore, VQ ratios can vary in different regions of the lung in a healthy person. Usually we'll look at the middle part of the lung. If somebody has pathological conditions, these numbers will change. Ideally, in the middle of the lung, you want to have a ratio of 1. As you can see right here, this is the optimal range for having a balanced ventilation and perfusion number. If it is below 1, that could indicate there is an obstruction in airflow. If it's greater than 1, that means there is a blockage in the flow of blood through the blood vessel.